Yeah, well, we made it work. We made it work. So I guess we're gonna give people a moment to join the live before we get started. And I guess we can do a check in. How your plant babies doing?
Okay, well, I think there was one that was there when we talked last, maybe a few weeks ago, a month ago, and it's gone. It was like on its last leg. It had like one green leaf, and then that one started looking very wilted. So I actually ended up, I think it couldn't be resuscitated, so I had to end up throwing it away. So I think I'm gonna just stick with flowers, bouquet, but getting a flower weekly or every twice weekly bouquet from Trader Joe's, and then as you can see, this one, its tips are brown, but it's hanging in there. It's been around, I think I mentioned at least 50 years. So she's hanging in there. She's good. She's a family member. Yeah, how are you doing?
My babies, we're getting through it. Like I've lost some babies, but I always tell people when you're greening your thumb, like that's a part of the process. Like you're going to lose some plants as you learn how to kind of navigate the plant world, and you'll get adapted to some of the plants that best fit you. There's a couple of plants in my collection, like the pothos and the syngonias. They are really resilient plants. And then in terms of
Amazonian plants, you said?
no, the pothos and as well as like the syngonias, the snake plants, just to name a few different plants that are really resilient and that are easy starter plants for new plant parents. They would really build your confidence, at least the pothos will. They'll build your confidence in terms of greening your thumb and being a plant parent. And then even in terms of like how I feel like culturally about the pothos plant.
I'm gonna write all this down as you're saying it.
And listen, we're going to have a recording. So the good thing about this is the pothos, the devil's ivy. The great thing about this is like culturally, like I've always known this to be a plant that has been central to the Black community. So my grandmothers and mothers and aunties, they've always had this and, either in soil or water. So I love it, but I'm not going to go on a tangent about plants.
Okay, no, that's great. I wrote these down, so I'm definitely gonna take note of them. And when I feel up to it again, confident enough, those will be either one pothos or syngoniia. I'll look into. That's when you plant baby.
Check them out and let me know. Let me know.
I
All
will.
right. So I think I'm gonna go ahead and get it started. All right. So hi everyone. My name is Rodderick Sheppard, and I'm a manager here on the prevention team at NASTAD, and I lead our social determinants of health programming. My pronouns are he, him, his. And so I want to welcome you to the very first Social Determinants of Health Live series, where we'll be looking to have more intimate conversations on where the community we serve works, plays, learns, lives, and pray as it relates to the ending the epidemic in the U.S. initiative. Our very first topic of discussion is PrEP and Black women. And who better to have this conversation with than with a phenomenal Black woman that I would like to introduce. All right, so our special guest today is Dr. Oni Blackstock. Dr. Oni Blackstock is recognized as a thought leader and influencer in the areas of health equality and, health equity and HIV. She is a primary care and HIV physician and the founder and the executive director of Health Justice, a health equity consulting firm that helps healthcare and public health organizations to center anti-racism and equity in the workplace and reduce health inequalities in the communities they serve. Before launching Health Justice, Dr. Blackstock served as an assistant commissioner at the New York City Health Department, where she oversaw the city's response to the HIV epidemic. Prior to that, she was an assistant professor at Montefiore Medical Center and Albert Einstein College of Medicine, where she conducted HIV clinical research focused on developing and testing interventions to promote engagement in HIV prevention and treatment for disproportionately impacted communities. She holds degrees from Harvard College, Harvard Medical School, and Yale School of Medicine. Dr. Blackstock is passionate about ensuring that all individuals and communities have resources and the support they need to thrive and achieve optimum health and well-being. What a phenomenal, like just a marvelous introduction. Like, wow, Dr. Oni, like, welcome to the show. Like,
thank you so much, Rodderick. It's really an honor to be here and to speak with you about this topic. It's really dear to my heart, but one I think that is really important for overall public health. And I just want to take a moment just to give recognition to someone who was a really amazing, was a Black woman living with HIV, an advocate who passed away yesterday, Rimsky Evans from Jackson, Mississippi. I just learned a few hours ago on Facebook that, Rimsky has passed, but she was someone I had the honor really of being able to be on panels with and to hear about her life story and to see the ways in which she really advocated and really increased awareness and spread the word about, women living with HIV, what their experiences are like, and then also, ways to sort of, enhance the lives of both women living with HIV, as well as those who are often placed at risk for HIV. So I just wanted to just take a moment to recognize Rimsky and her life and to send love to her family and friends.
I was taking a moment of silence. My sincerest condolences, one, and may she ascend and rest and rejoice in the heavens of the stars. I'm so sorry to hear this.
Yeah.
All right. So let's get into it. So when I was thinking about this topic, we've made so many advancements in the HIV field since the first reported cases in 1981, but we still have room for growth, especially when it pertains to Black women. A big part that I feel like that needed to be a part of this discussion is discussion of marketing and the promoting of sexual health for Black women, which is like an ongoing opportunity. I think about sometimes we've had some successes, but we've had some opportunities where Black women could have been more a part of the conversation, like when Truvada went generic and Descovy was FDA approved for cisgender men and trans women, but not cisgendered women. And just even looking at the commercials, I just dreaded like Black women seeing this commercial and not thinking that PrEP wasn't an option for them. Like a simple blurb of communication in the commercial, could have just included why Descovy is not FDA approved for cisgender women. There are other options for you. So it's like little stuff like that has happened amongst I guess the promote for Black women and PrEP. So Dr. Oni, what I ask you is how can we better promote and engage Black women on accessing and incorporating PrEP care into their sexual health care?
Yeah, no, I think that's such an important question. I think it has to be a multi-pronged effort. I think we have to use many different avenues to reach Black women in particular. And I think, while there are some, I think we'll talk about this a little later, but there are some like pharmaceutical companies like ViiV Healthcare, they're doing some like intentional work with reaching Black women and Black women who may benefit from PrEP. We know that, overall, like you were saying, when Truvada came out, a lot of this was, marketed to men who have sex with men or same gender loving men or bisexual men. And so I think when women see that, they're like, oh, this is not something for me. And they're not hearing other women talking about how, PrEP can be used as a tool to, empower them, to allow them to have, less worry or anxiety when they are being, intimate. Allows them control, in terms of, protecting their health. If they're not hearing messages like that, they're just going to assume that this is not something for them or not something that they can benefit from. So I think, that's why people like, Rimsky, Evans and there's so many women, Black women who have been really advocating. And obviously, Dr. Dawn Smith, who was at the CDC, she also passed away a few months ago, but she was a huge advocate for PrEP and PrEP for women. And so we've really relied on, Black women in the community, in public health, who are really the ones who are like, lifting up this issue, which has often really been ignored. So I'll just say that at the forefront, but there are lots of different ways we can do this. I think, one thing is working with community-based organizations that are really uniquely positioned to reach women, in particular Black women. And what we did when I was at the New York City Health Department is, fund organizations to create their own campaigns that will speak directly to the women that they're serving. Because as a large health department, you'll try to make a general campaign, and that may connect with some women, but really the community based organizations, they sort of know, so what are the messages that are really going to resonate with women in their community. And so I think there's like a lot of success with that. So these sort of homegrown, PrEP social campaigns can be really helpful. I think we have to get, and then I think I can stop, but we need to get providers, many different types of providers, primary care, OB-GYNs, family practice providers, all feeling comfortable with talking to women about PrEP, providing universal education. You always say that, PrEP might not be for all women, but all women should know about PrEP. So we want universal education about PrEP so that women, along with their providers, can have a conversation about whether this is the best tool for them. So that's just a few examples of ways I think that we can really work to sort of increase awareness and potentially uptake among Black women. And just to say, we're talking about, I know for this, we're talking about are we talking about Black cisgender women in particular, because we know that like Black trans women, have an even greater burden of HIV and face some shared, but also some unique vulnerabilities when it comes to HIV.
Yeah. So the intention initially was to kind of talk about cisgender women, but I don't want to exclude the transgender women from the conversation because they are women. So, and they do have kind of like their own set of issues that they have to deal with in terms of navigating HIV treatment and prevention services.
Yes, but some of the shared risk factors are like gender-based violence, like cis and trans women are both impacted by that, but then there are other things like access to trans-affirming care. There's transphobia, all of that also doubly impacts trans women in particular.
Yeah, even in terms of like some of the services that they receive, unfortunately, like I think a lot of times trans women can go into these services and they can be traumatized by the service that they're provided. In my previous role and position, I recall like having very long conversations with our trans patients that were referred to the PrEP clinic that I worked in, and I really had to have a conversation and let them know that we're using a trauma-informed focus in your care. We're aware of some of the treatment that trans individuals have faced in terms of navigating the healthcare system, and we're about combating that narrative and setting a new precedence of what it looks like to receive healthcare as a trans individual. So I like how to have like long conversations to build a rapport and a trust with the trans community because they have been traumatized from some of the experiences that they have faced in healthcare.
Right. And I think what you're talking about, this idea of trust and having like a trusted, healthcare provider, or if it's a peer educator or counselor, someone that you can sort of feel like you're confident in what they're saying, that they're looking out for you in your best interest, that helps tremendously. And so I think for trans women and cis women, having, if it's patient navigators, peer counselors that have similar like lived experience and can speak to like even their own experience, if they are also on PrEP, that's actually even more powerful because, we don't actually hear a lot of narratives from women in general about their experiences on PrEP. So really thinking about, hearing from women like, oh, this is why I'm on it, and this is why I started, and this is how it's worked for me, I think is really important and helpful.
Okay, thank you for that. I want to kind of try back to something you had mentioned earlier about like how when we discussed the medications have been often marketed towards men and gay men, and this has happened since the start of the epidemic, which is interesting. So I wanted to know, like, how do you think HIV been labeled as a gay disease during the early stages of the epidemic impact the current day views and beliefs around HIV for Black women?
Yeah, well, just want to say, like, much respect, and big ups to all of the Black women in particular who were fighting to raise the profile of Black women living with HIV and women living with HIV in general, especially at the beginning of the HIV epidemic, because as you said, it for a very long time was viewed as largely a disease that affects gay men or some gender-loving men. But we know from very early on, Black and Latino women were diagnosed, like Black and Latino women, I believe, were among the first cases of HIV among women. But the reality is, this was not highlighted, nor was the fact that like Black and Latino people were disproportionately impacted. And so it took a while for, I guess, the outside community and funders to really understand that these communities were being disproportionately impacted by HIV. And you probably know, like, women had to really advocate for things like cervical cancer to be considered, AIDS-defining illnesses or opportunistic conditions that would then sort of qualify as an AIDS diagnosis, and then maybe and provide access to important benefits and life-sustaining benefits. So this has been something that's going on from the very beginning of the epidemic. I personally think some of it, the lack of attention to women, has to do in part, at least here in the United States, with although women account for about 20% or 25% of people living with HIV, I think the women who are affected by HIV tend to be Black and brown, like cis and trans women. And I think often people marketing these medications are not, don't think that this is maybe a profitable or worthwhile pursuit to engage Black women. And I just have to say, more recently, ViiV Healthcare, they're doing a lot of work specifically targeting Black women in their ads. And I think that that approach can be helpful, especially if it's done in a way that is like affirming and validating, and it's not like pathologizing or stigmatizing of Black women. But we've really relied on community grassroots efforts to really raise awareness, as opposed to
relying
on, pharmaceutical companies, or for a while, even public health departments to talk about, PrEP, HIV among women, and particularly the benefit of PrEP.
Okay. Yeah, that makes sense what you're saying, in terms of how we should approach health issues. Is there should be layers of things going on simultaneously at the same time, to kind of help the efforts. So you can do things on a community level, you can do things at the State Department level, you can do things on a national level. There should be a multitude of things happening for, especially for especially for communities that are disproportionately affected by HIV. And like you said, Black and Latinx women are of those that are disproportionately affected by the virus.
Right. And then also, women in sub-Saharan Africa, we see some of the highest rates of HIV among adolescent girls, also women in sub-Saharan Africa. But again, I think pharmaceutical companies may not view these these communities as profitable, and so have really focused on US and Europe and same gender loving men as the communities that they're focused on. But we know that women lead communities, lead families, and so and are often the way that people find out about information. It often comes through the women, through mothers, through aunties, through close family friends who are able to share and disseminate information in a way that people listen to them and they're like, yes, okay, yes, this is new, this is different, and I trust you, I trust what you're saying. So it's but I feel like over the last 5 years, we've seen more increasing attention, at least, to how women can benefit from PrEP, which has been, I think, really, really heartening.
Yeah, I've been happy with some of the information I've seen released about women in PrEP. In particular, I got to highlight DC Health's PrEP for Her campaign. I thought that was a wonderful campaign. Let me ask you, so what are the importance of having programs like the DC Health PrEP for Her campaign, the CDC hashtag She's Will PrEP for Women campaign?
Right.
What is the importance of having?
Yeah. So thanks for mentioning those. Yeah. So DC PrEP for Her. The CDC has She's Well with resources that folks can just go online to get. And I'll just say this as a plug because I'm a CDC ambassador to really encourage folks who are both providers and also folks who potential users or just the general public to go to the Stop HIV Together, Let's Stop HIV Together website, and then they can access She's Well through that. And then also just to say, put a plug in, since I was at the New York City Health Department when our whole team launched the PrEP for Women campaign that was in our subways and buses and on social media. And I think it was super exciting. It's like we had images of Black, brown, white women, having fun, looking, excited, joyful, and really we're about promoting this, kind of flipping it on its head as opposed to focusing on the risks, focusing on what the potential benefits are for women. And I think it's really important because it helps start the conversation. It raises awareness. We know many women still are not aware of PrEP or have not heard of PrEP, especially women who could benefit from it. So I think those types of campaigns are incredibly important and important conversation starters, but they're one sort of prong of a multi-pronged approach that we need.
Okay. All right, so let's go down the yellow brick road, as I like to say. In my professional experience of working with Black women and women in general, I love working with women in sexual health and wellness. They're always the ones that's easy to talk to about sexual health. I was always able to create risk reduction plans that I felt confident in as a counselor, and even recruiting for testing was super easy with women. But as I transitioned into a role at Women Working Health in a PrEP clinic, I realized that there was definitely an opportunity to have more education and more PrEP engagement with women, because in the 3 years that I worked there, I had never seen a Black female patient, never. And our clinic was really, really busy. So for me, it would have been nice to see some Black female patients come across my threshold when I was doing that type of work. And the community is also interested in this topic around recruiting for PrEP for women. Dow Hewitt left a comment under the live event posting stating a need that they need to recruit more women into their PrEP program in Westchester County. So my question to you is what type of recruitment strategies will you offer to people like Dow who have a need to recruit women into their PrEP care services?
Yeah, I guess a few things. I mean, I think one is I always talk about that. Well, actually, so relatedly, really understanding what women care about. And, I don't want to generalize, each woman may have sort of different priorities, but I think it's incredibly important to tie in, let's say the woman may be there, that she would be tested for, sexually transmitted infection. That's a perfect time to bring in discussion around PrEP. So just really that's an easy one to link. But if it's around breastfeeding or someone coming in for breast cancer screening or cervical cancer screening, whatever it is, really thinking about how can you tie PrEP in and really help to normalize HIV testing, as a routine routine aspect of healthcare. We know the CDC recommends that the general population between ages of 13 and 64 be tested, at least once in their lifetime. But so routinizing and normalizing HIV testing is important because that's the gateway often to these conversations around PrEP. So if someone tests negative, you can say, oh, great, we have this whole prevention toolkit. And so we want to make sure that testing is something that women are thinking of, that's integrated into care, and that's not seen as something that only certain people who have certain lifestyles or whatever, quote unquote, are offered, that everyone's offered this. I also just want to say, I think the fact that there's now a second medication that is FDA approved for women. So there's injectable cabotegravir that has been approved for PrEP, that was in December 2021 for women. And so I think now having more options, so we could be we have a pill, we have an injectable, I think similar to, when people have, reproductive capacity, people talk to them about, these are different ways that you can, prevent pregnancy, reduce your risk of pregnancy. having options is incredibly important, because not everyone's going to want to take a pill a day. And now there is an injectable that's every, first 2 months, it's monthly, but after that, it's every 2 months. And so that for some women, that may be great. They don't have to take a pill a day. So I think, letting women know about options, there's PrEP, and then there's also, post-exposure prophylaxis, condoms. But I think what's very unique about PrEP is that it really is user controlled. You can let your partner can, know about it. They cannot know about it. You can use your discretion. No one needs to know, whatever you feel comfortable with. So I think that's really important versus insertive and typical type of condoms, a partner may say, well, I don't feel comfortable using this. Why do we need this, et cetera. So just related to outreach, as you were saying. So I think also, again, turning it, Vive Healthcare has this, and they're not paying me for this, has this campaign called Risk to Reasons, where it's about, I think it's the whole thing about, again, what matters to you versus what's the matter with you, instead of being what are your reasons for coming into care? What are your reasons for taking care of yourself? Is it about pleasure, intimacy, empowerment, and just being able to connect with some of those things that are important to women, and tying PrEP in to that, I think is really important. We've also done different outreach programs with peer navigators, talking to women who are involved in sex work, women who may be injecting, women who may be homeless, just providing education and letting them know what's available. But we didn't do this in a vacuum. We did it also being what other housing services do you need? What other health services do you need? How can we get you to the clinic? So just really bundling it with other things that women are going to care about. Because, for a lot of women, HIV, the vast majority of women, HIV is not a priority, they may be worried about, housing, where they're going to sleep, their meal the next day, whatever it is. So again, just really understanding what women's needs are and interests are, and trying to link to that.
Yeah, that is so perfect, because I do know, in certain health models, you are going to have to incorporate the client's beliefs and personal views in how they access care, or how they have their beliefs about HIV or whatever the health concern is. And I'm happy that you mentioned that we have options. I always, as a sex educator, I always like to let people know what tools they have in their sexual health and wellness toolkit, as I like to call it. I recorded on an interview on my personal platform with Ashley Cobbs from Sex with Ashley, and she spoke about her experience in doing the Aptitude, which is the injectable PrEP, as a Black woman. I was so excited to sit there and ask the questions about how was the experience, because as a gay man, I'm considering the injectable as an option. And the thing that I love about the injectable is you don't have to get ready. You can always just stay ready with the injectable. And for me, I'm a little inconsistent with my PrEP sometimes, but that will always the shot will always be an option for you.
Yes.
For sure. So shout out to Ashley.
That's great. What else did she say about her? What was her experience like? I'm just curious.
So she said it's no different than getting a shot, getting a COVID-19 vaccine. You'll have some soreness at the injection site. She wanted to do it to show as an example, this is also for you. This is something that I'm doing, and I'm not having no crazy side effects. I ain't lose all my hair or nothing like that. She wanted to be an example for Black women and PrEP. So shouts out to her for that, for sure.
That's exciting, and again, really brave. And again, we don't really hear a lot. Like you mentioned, I haven't seen any other women speaking probably about injectable PrEP, but who've taken it themselves. So important to get those narratives and those stories and those experiences out to the general public, because someone could see themselves in Ashley and be like, oh yeah, this is great. I didn't know that. And I think a lot of people may not be aware. So that's wonderful that she's using her platform to share that information.
And I know you spoke a little bit about this. I don't know if there are any other strategies that you can offer in terms of integrating PrEP into services that women access, from primary care services, HIV testing and counseling, and female reproductive care services.
Yeah, I was just looking back, thinking about some of what we did when we were in the New York City Health Department. So again, one thing I think that's really important actually, that, it's not the case for all women, but like, sometimes it may take multiple conversations about PrEP to get someone, sort of interested in making a decision. Because a lot of times women are interested in it, but they may need more time to like mull it over and to think about it. So often what we saw in a lot of community-based organizations and clinical sites that were funded to talk about PrEP for women and link women to PrEP or provide it, was that often the women who were working there would really engage women over a period of time, like check back in, like, oh, hey sis, in a lesson we talked about PrEP, like, do you have any other questions? Like, what are your thoughts about it? And it just allows women to get like more information so that they can feel comfortable with their decision, whether they decide to take it or not. So definitely that can be really helpful. I think also, again, like tying it in, like I had mentioned, like before, like there were women would come in for different wraparound services, like housing, other benefits, talk to the women about PrEP, then to like, just whatever, but like in a way where it's like not random, really tying it in, where you have conversations around, overall health and how sexual health is a really important part of our like overall health and well-being. So yeah, just being able to like tie it in a way that is, is affirming, is addressing whatever needs they are voicing. And then also like, I think asking for permission too, like, I'm wondering if you've ever heard of PrEP. I wonder if you have some time I could talk to you a little bit about it and, answer any questions that you might have. So just creating opportunities also to learn about it. I think
Yeah. Yeah, I wholeheartedly agree, because when I think about PrEP access for women, like I think like, when they go get, their mammograms or pap smears, like the doctor should be talking about, that's an opportunity to talk about PrEP there. HIV testing and counseling is always an opportunity to talk about PrEP within your risk reduction plan. Like PrEP is an option to reduce your risk.
Yes.
So yeah, I definitely agree that there are many ways to integrate PrEP into care. And then also in terms of what you mentioned about like having the follow-up conversation, that's like the rapport I miss having with my community. You're talking about the people that come in every 3 to 6 months, or, might have their primary care services, and you see them more frequently. You build a relationship with them, and you have updates when you see them on their sexual wellness checkup and talk about what's going on with the latest boyfriend and stuff like that. Like that's the type of community work I kind of miss, but I also enjoy NASTAD thoroughly, but I love it.
Yeah, those relationships are so important. And then I also wanted to say, like, just also thinking about how can we meet women where they are, like physically, like, not relying on folks having to come into a healthcare setting necessarily to like get started on PrEP, like, using mobile outreach, being able to provide like a starter set or kit for women to start, same day. I think all those things, things that have been used in outreach around PrEP for men who have sex with men and bisexual men and other men who have sex with men, like, just thinking about like, what can we learn from some of these other models that we can apply? And then there are going to be things that are different. There are going to be things that are very different, obviously, because cis and trans women have other needs and other realities and other experiences. But like, we really need to continue to like really innovate and think about this, because this has continued to be like a really tough nut to crack. Like, I've been doing research on women in PrEP, I think since when? Maybe since I think it was like approved. Yeah, I mean, it just seems like and the great thing, obviously now we have more options and stuff like that, but like, it's still, I think, there are so many wonderful people out there who are really looking at these questions and trying to think about like what we can do better to reach women.
Okay. Now, I don't know if this is your area of expertise or you can speak to anything about that. It's a topic that I personally have been exploring a lot more, is women's maternal health. And then my mentor has suggested to me, I was a part of a Black Public Health Influencer internship opportunity where we did a 4-week campaign on a topic of whatever we wanted to select with sexual health. I chose to incorporate maternal health just because I did a paper last semester on maternal health, and some of the information that I found within like my research is like astonishing to me. So I wanted to know more information. But I feel like this conversation, we don't have a lot. And so I don't know if you'll be able to provide any input or talk about any conversations that we need to have around HIV, PrEP, and maternal care.
Yeah. I mean, I think, there have been a good number of studies for oral PrEP, and I need to get more familiar with the literature on injectable PrEP, but for oral PrEP, any potential risk outweighs, benefits outweigh any potential risk, and generally very safe in women who are wanting, or people with reproductive capacity who are wanting to conceive, people who are pregnant, people who are breastfeeding. So we know that, people, reproductive capacity can safely, benefit from PrEP. Taken at these different sort of periods of time, and that just helps their own reduce the likelihood of themselves getting HIV, but also of potentially passing it on either to the fetus or to the infant once the baby is born. So definitely that's what we say. OB-GYNs are very uniquely positioned to be talking to folks with reproductive capacity or potential about PrEP, and they have a natural sort of in and often, I think because people want to protect protect themselves, but also like their, the fetus or the baby, people are maybe more likely to also like be willing to be like, okay, this is something that's safe. It's for me. It's going to protect me. It's going to protect my baby. Let me try this.
Yeah. Yeah, for sure. And just to track back on a point that you mentioned when we talked about the campaigns where I believe like one of the campaigns was targeted for women and providers. And I think that it's so important to have provider buy-in on PrEP for women. So therefore, that way when Black women have questions about PrEP, they have somebody to turn to. And then also referring back to the integration piece, if you have buy-in, then you're more than likely going to offer it to your patient versus if it's something that you're not comfortable, I imagine a provider would not offer that service to a Black woman.
Right. Yeah. And the thing is with PrEP, healthcare providers can be a huge barrier because they're really also the gateway. Like, I think, with other forms of, HIV prevention, most other forms, condoms you can get on your own, you don't need a prescription. But PrEP, you do need a prescription. So we really need to ensure that providers are educated and are talking to their patients about it. And just to say, if there are, any women who are watching who, are interested in PrEP and like they haven't had any progress with talking to their provider about it, it may suggest you need to find a different provider. And there are also like PrEP locator, programs online where you can put in that you're interested in PrEP and they can direct you to a provider who will hopefully provide more affirming and validating care.
Yeah, I always refer patients to, or at least there's this search engine I'm familiar with, is the preplocator.org. And you enter your zip code and they'll give you a list of PrEP prescribers near you. But, it's interesting in terms of access, like access doesn't always look the same. Sometimes there could be what I'm starting to hear of like a provider desert where there's a limited number of providers that you can go to. And so if this particular provider isn't working, then in certain areas, like you'll have a problem like identifying another one.
Yeah, and that's why we need to like also widen like, the number to provide, well, it may also be like, given how relatively safe it is for younger folks or folks who don't have any comorbid conditions, it may be something that like to consider, like, do we really need a prescription for this? But also, I'm sorry, I just lost my train of thought. So do we need a prescription for it? Yeah, I'm sorry, just lost my train of thought. But I agree with you. There's some other points.
No, it's okay. You know what? Mercury is in retrograde, Dr. Blackstock, and so a lot of like craziness has just been happening in the world.
Oh, tell me about it. Oh my goodness. There was something I was gonna say. We need to right. So scope of practice. So there's some states where pharmacists can prescribe PrEP, but many states they cannot. But we need to get like more providers able to prescribe this so that someone doesn't have a primary care provider, because there are many people who don't, that they can go to, there are pharmacy deserts. However, if there's a pharmacy that is accessible, someone can go there and they could get prescribed by a pharmacist. But unfortunately, that's not the case in many states. And we need to basically work on expanding scope of practice for pharmacists as well.
It also seems like it's a way to kind of demedicalize PrEP. I know that has been like a big topic of conversation by being able to just access it by walking into your pharmacy, where I think transform like how people access PrEP. And it's not like the pharmacists don't have access to some of the same tools and resources that the providers do in terms of working with like the PrEP navigators and things. Should there be like any insurance issues? It's just, it alleviates a double layer of barriers for our patients to access what they need.
For sure. And this is making me think about, the FDA disapproved over-the-counter contraceptives. So like, again, like reducing barriers, folks can just go in. Hopefully, I don't know the issue around cost. I haven't had a chance to look at that. But yeah, that would be wonderful. People could just go in and be like, I want to take PrEP. And, if they meet certain indications in terms of not having other, conditions that could complicate their course, that being an option for them.
Okay. All right, so I want to pivot to I guess a couple of things. So on a professional level, like I personally heard critiques that the field of HIV treatment and prevention is dominated by gay men, and I might have to agree with that statement. There are quite a few of us in the field, but we also have phenomenal Black women like you doing the work too. So, we can't just not acknowledge that the Black women are still on the front lines of this effort. So I'm just wondering, how can we ensure that women can be heard in the field, but then also how can we hear voices from Black women in the community? So how can we make sure that Black women as professionals and on a community level have a seat at the table when it comes to PrEP access for Black women?
Yeah, I mean, I think like what you're pointing out is like a larger, it's related to other inequities, right? Like in general, we don't really see, just in research and science, women aren't always, as represented, people from marginalized groups, and think about intersectionality. Yes, sure, you said it, the field could be dominated by Black gay men, but I mean, by gay men, by Black gay men. We may need, more representation of Black gay men and Latino gay men in this space. So I just wanted to point that out. But, I think there are so many, I'm just saying, like, I know so many women who are in academia, doing advocacy and community-based work that are in this space, doing this. And I think it's more really about, us coming together to advocate and lift up a lot of these issues, like Leisha McKinley Grant, like Leisha, is an HIV advocate based in the South, and she's done so much, even on her own, with her own platform, kind of like how you have your own show. Like she has, I think partnered with, I think other pharmaceutical companies and other organizations to really create space for these discussions to happen. So I think we're, it's, again, and we Black women, obviously we can't do this on our own, like obviously having co-conspirators in this, having Black men, white women, white men also really lifting this up, because I'm just remembering when I was in research and submitted a grant that was focused on, I think it was on cis and trans women and PrEP, like one of the responses was like, is this, is HIV really an issue, for women, especially cisgender women? And I was like, and this is people who are like reviewing my grant and deeming whether it's like worthy of funding or not. So it's just, again, like people need to, we have, the folks who are controlling the purse strings, like many of them are not, they don't really have values that align with ours, are not aware of we're not aware, but I think are really ignorant to what is happening. And the reality is, like, having a provider who comes from a similar background, researcher from a similar background, like I think we're able to, make connections and provide insights that other folks just are not able to do, because they're not familiar with the community. They have not lived among the community. So I think, it's important for us all to be represented. Black gay men, Black cis women, Black trans women. I don't know, I personally don't know any Black trans women who are involved in HIV research. I know some Black trans women who are in, in the field, in sort of in the field of public health, but none that are leading a study. Why can't Black trans women be leading studies? We can have community PIs as well. So it's just, we just need to also be fighting. It's part of our larger fight for equity and justice, and having a role in terms of decision making that is going to impact us and impact our daily realities. That's what true equity is, like having access to opportunities and resources the same as everyone else, but we know that's not always the case. So those of us who are in this space really need to push and look out for one another and like bring folks with us as we do this work.
Oh yeah. I definitely feel that. One of my good friends that I actually do I keep talking about my personal platform. I should plug it, but he is always inclined and always is that reminder for me of how can we expand and reach out to members of our community to be a part of the process. I don't have to take all of the speaking opportunities and engagement.
Right.
I can allow somebody else to have a seat at the table and kind of voice their opinions on certain matters. So he always has my wheels turning about how can myself as an established professional in public health and now bring in the younger generation, the older generation, and then a diversity of people to be a part of something that impacts us all.
Yes, 100%. No, totally. Yeah, and in my work, I actually have colleagues. Sorry, I have colleagues, who are Black trans women who have not necessarily been empowered to do the amazing work that they can do. And so, like, whenever we are in a position to do that, we have to create space, and again, center folks who are the most burdened, who they're most in need, because folks always know what needs to be done. Like, it's a lot of times it's, but they're not the ones who are able to, who are are listened to and or who are leading in order to create the change that's needed.
Okay. As we start to wind down on our discussion, I got 2 more questions for you. The first one is just, do you have any resources you recommend to our EG jurisdiction members on expanding their PrEP care services to be inclusive of Black women and women in general?
Yeah, so again, I would use PrEP, the CDC's Let's Stop HIV Together PrEP She's Well campaign has some great resources online. They have sort of different like assets like videos and other graphics that may be helpful. They have literature. I would also say like ViVE Healthcare has Risk to Reasons, and they have material for providers as well as for women who may be interested in using PrEP. They have like workbooks and lots of really exciting exercises. So I would look up Risk to Reasons online, and they have some really good resources. And those are the 2 that come to mind immediately. And just in terms of implementation, I've been part of different like webinars, Help HIV. I believe all of this data, all of this information should be archived and accessible, but have given talks about PrEP and women, particularly around cisgender women, and what are some strategies that, in my experience at the New York City Health Department, that we've found to be helpful. So just would put a plug out, for folks to take a look at that information if it's still online.
And just a final question. I wasn't certain if you have any expertise on this one either, but if you have anything to offer, then we would love to get that final go to nugget before we close out. Can you speak to any ways to better use and get creative with funding to maximize the opportunity on engaging Black women in PrEP?
Oh yeah, I mean, I think we basically need to make sure that we are funding, again, Black women-led and serving organizations. So organizations led by Black trans women, by Black cis women. And, because often what we do is see funding sort of go to some larger organizations that don't necessarily have like leadership that's like reflective of the communities that are being most impacted or not located in the communities being most impacted. And so, I know some of the work that we did, the New York City Health Department, for instance, was like funding trans women-led organizations, and those are primarily Black and brown trans women-led organizations. And I know, HRSA had a Black women in HIV funding. I think it was for women living with HIV. I don't know if it was for women living with HIV, but like in that grant, that effort, I think only like 10% of the organizations funded were like Black led, and none were like led by a trans woman. So it's like we need to, there's like a misalignment in terms of like often where funding is going. And so I think there needs to be more like sort of explicit sort of direction given that like we want to make sure that we are serving those organizations that have been doing the work or on the front lines, are led by women, who are part of these impacted communities. Again, the healthcare, they had a grants from, I believe last year or maybe earlier this year, that they focused on, were focused on sort of Black women and PrEP and Black organizations or initiative focused on Black women. So I think really being really explicit about these opportunities and providing, ample, funding support, whatever other support that are needed, I think is really key to much of this.
Okay. And I want to ask you one more question before we go. We did get some questions from registration in the Eventbrite, so I wanted to make sure I at least ask one. So do you have any suggestions on how to destigmatize the need for PrEP, especially as it pertains to access for Black women?
Yeah, I think sort of like similar to some of the things I was saying, so again, like universal education, like if everyone is talked to about PrEP, everyone knows about it. It's not just women who are deemed like quote unquote at risk. So providers can do that, peer counselors, like anyone can talk to women about PrEP and just, have it be a normal, like HIV testing, a routine part of healthcare, or, there's a CBO that is doing HIV testing. Say, this is something we offer everyone in the community. Is it something that you're interested in? So I think that can be really helpful. So just like, again, just talking about it, like it's, we check cholesterol, we check HIV tests. If you test negative, we talk to you about PrEP. Like it's just, part of what we do. And again, I think also hearing from women, hearing stories from women who have taken PrEP, who have benefited from it, their whys, their reasons, I think are also incredibly important, because women will be able to see, like, this is someone who looks like me, who's in a similar situation. Maybe this is something that I could use, that could help me. So.
Okay. Thank you so much, Dr. Oni Blackstock. Oh, this has been amazing to talk to you about PrEP and Black women. I think it's definitely an important conversation to have. And then also just from the engagement in the community, this is something they wanted to know about. And this was really, really great to do this with you. So could you plug like your personal platform? How can our viewers reach you? How can we get in contact with you and help justice? Like, we need to know the tea.
Right. So just to say that, all my work in my research that I was doing focused on like Black and Latino women, Black and Latino people, and HIV treatment and prevention. I think through that work, doing that research, and then focusing on it in the public health sphere, through that work, really got involved in really intentional racial equity practice and organizational change. So just so folks know, and I think you said this at the beginning, so I'm currently founder, executive director of Health Justice, which is a racial and health equity consulting firm. So we do work with healthcare organizations, public health departments, other health affiliated organizations to really help them with centering anti-racism and equity, and as they work to really eliminate the health inequities in the communities that they serve. So you can go to healthjustice.co.co, so not .com, .co, so healthjustice.co. I also intermittently tweet, I haven't been as active, but on Twitter, usually about health inequities and what needs to be happening. I'm also on LinkedIn. So basically, I see for me, HIV, I always say, it's not just a medical condition; it's a social condition. So it's very much a part of, even though I'm not in research and sort of have a toe in public health, when we look at all the inequities by race, by sexuality, by gender identity that exist within HIV, I mean, doing equity work is doing HIV work, or reverse.
Yeah, for sure. Thank you for all the work that you do for the community and that you've done. And again, it was really, really great to be in this space with you and to have this conversation with you. In terms of the audience, so this was like the first one of our Social Determinants of Health live series, and we're going to see what else we can do. We wanted to find some more different, innovative ways to engage with the community outside of the Zoom. I know after the pandemic, like, we are kind of like worn out on Zoom. So I'm definitely trying to get creative in just how we bring content to you all to help, some of the work that you all are doing on the front lines.
Yeah, this is great. I really appreciate and honored to be the first guest in the series, and really excited for you and excited to see sort of the progress and continued success. I would say this is like success of the series. So thanks so much for having me.
Yes, thank you, Dr. Oni. You have a good one, and I hope we can work together again in the future sometime.
Okay, sounds good, Rodderick. Take care. Thank you, Maeve, for behind the scenes. Okay.
Yes, shout out to Maeve in the communications department at NASTAD.
Okay, bye-bye.
Bye bye.